My name is Professor Jeff Holst and I'm based at the University of New South Wales in Sydney. This project that we're working on is in prostate cancer, and prostate cancer is the most frequently diagnosed male cancer in Australia. So it's a huge problem for Australian men, and particularly as our population is ageing, more men are getting prostate cancer. And so the project that we're working on is trying to find new ways of treating prostate cancer, and specifically trying to treat the prostate cancer that becomes incurable. And so that's really a huge need. So one of the problems with trying to develop drugs is that the models that we use aren't always reflecting what's happening in a patient's body. And so what our team has developed is a new way of being able to grow prostate cancer cells or prostate tumours outside the body, and giving them the nutrients that they need that match what is there when they're growing in the body. And that's enabling us for the first time to really test how drugs work on individual tumours, and giving us that idea of how they might react when we give those same drugs to patients. Currently for prostate cancer patients, if you can remove the tumour, many men are cured of prostate cancer. And the problem that occurs is that some tumours become resistant to the current anti-androgen treatments, and these are the tumours that specifically we're looking at in this project. And we've found that how the cancer cells use their metabolism changes when they're treated with these anti-androgen drugs. And so what our project is trying to do is to come up with new ways of being able to treat those cancers that become incurable by becoming resistant by targeting their metabolism. So the long-term view of this is that the patients that we want to be able to treat with these new drugs or drug combinations are those that are more likely to die from prostate cancer. So the long-term impact of that is really that more men will be able to live with their prostate cancer and live a long and full life. So I started doing cancer research because cancer has affected my life in many different ways. Multiple grandparents have had prostate cancer and breast cancer, and indeed my parents and many family members, uncles and aunts as well. So it's really something that I think affects all of us. Probably 1 in 2 Australians are affected either directly or someone in their family or friends have cancer, and so it's something we really need to do something about. And so that's where I've put my efforts into doing cancer research to try and help, obviously not my grandparents anymore, but hopefully myself, my friends, my family and my children as well. The Cancer Council community of fundraisers is absolutely amazing. The money that comes in goes directly to research projects like mine that are really trying to develop the next therapies for prostate cancer and for many other cancers. We can't do that without those fundraising. So whether it's going on the 7 Bridges walk or whatever it is that you're doing, getting out there for a morning tea, all of that money goes directly to these research projects, which are making, hopefully, huge changes for patients in the future.